Over 1,800 healthcare professionals attend this conference every year, including international delegations. I have with me now Dr. Ahmed of Pakistan. Thank you so much for being with me today.
Thank you for inviting me.
Well, I understand you're very involved in the area of eHealth. Can you explain to me what that is?
Yeah, as the name suggests, eHealth is healthcare delivery using all different information technology tools. We used to call it telemedicine and telehealth, but now we have eHealth as an umbrella term which includes health informatics, telemedicine, telehealth, and the focus is to deliver healthcare using information technology efficiently to people everywhere, wherever they are, whenever they need it.
Okay. And so do people find that that's a much more practical way to get their advice than going and physically seeing a physician?
Well, eHealth or telemedicine is actually not a replacement of a physical interaction between a patient and a doctor. But since the burden of disease and the issues in healthcare are so many that you just cannot afford, and it's not even practical to deliver healthcare only through physical interactions. And since technology is available, whether it's mobile technology, whether it's video conferencing, whether it's web-based applications, eHealth uses all this technology to deliver healthcare, as I said earlier, to deliver healthcare efficiently, if I may.
How do people pay for healthcare in Pakistan?
Well, in a country like Pakistan, just like other developing countries, essentially the government has the mandate to deliver healthcare to everyone, and people are not expected to pay. So the healthcare is free for all. But the reality is that around 70% or more healthcare is provided by the private sector, and the government has not been able to actually provide healthcare to everyone throughout the country. Pakistan is a country of 180 million people, and it's a pretty big area with different regions. We have plateaus, we have deserts, we have high mountains. So it's really difficult to provide healthcare, considering the fact that that the resources are scarce. We don't have adequate number of healthcare professionals, and whatever number we have, most of them are actually saturated in the larger cities. So we have a situation where we have around 60 to 65% of people living in the rural areas, and they do not have access even to the basic healthcare services. That's
a very high percentage. What is the priority of the Ministry of Health now then?
Well, the Ministry of Health has embarked upon an eHealth, and so they have developed a division, and they're working with the private sector. They're working with WHO to explore how eHealth or telemedicine and all these tools or technology could be leveraged and used to deliver healthcare to everyone throughout the country, and especially the people living in the rural areas.
Aside from the geographical challenges, what else do you see as a challenge that you must overcome to make that happen, to get healthcare to more people?
Well, in a country like Pakistan, which is a developing country where there are lack of resources and opportunities for some healthcare providers, first of all, the number is very less. Secondly, whatever number we have, like I said earlier, that they are saturated in the largest cities. So that's a challenge. The third is that they do leave the country for better opportunities, and that again leaves us with lack of trained human resource in the healthcare, whether it's doctors or nurses or other support staff. So I think this is an ongoing challenge for a country like Pakistan or any other developing country, and that is why it is essential for Pakistan and for us to leverage the extraordinary advantages and benefits of technology and work against these odds and challenges, and keep our focus on delivering healthcare to the patient, which is the center for all this activity and development and efforts.
Mm-hmm. Dr. Ahmed, I've met you at this conference before. What do you find most useful in speaking with other healthcare professionals here?
Well, first of all, it's always a pleasure to come and speak and interact and learn. So I think that it's a great learning opportunity for anyone, whether you're a speaker or a participant. So I learn always when I come here. I learn a lot. It is a very good networking opportunity. So we do meet people who are working in areas which we want to know more about, because that's the experience which we could learn and then share in our part of the world. So I think it's a good networking opportunity. It's a good learning opportunity, and it's I would love to come again, whether as a speaker or a participant.
Okay. Well, thank you so much for your time today.
Thank you very much for the time yourself.
I'm Mabel Jong at the World Healthcare Congress in Washington, D.C.